itself. Mark, thank you for joining us today. Over to you.
Well, Tedros, thank you. Thank you very much indeed. It's great to see you. Great to see Mike with you also, by the way. I don't think I've seen Mike since the day before yesterday. So I'm very pleased to be with you. And I'm very glad also to have this opportunity to say thank you to everyone in the professional media who's been covering the pandemic. I think that by and large, the world has benefited from professional coverage of the pandemic, and I'm grateful to responsible journalists for their role in that. So as Tedros has said, today we published the third version of the UN COVID-19 Global Humanitarian Response Plan. For the first plan in March, we sought $2 billion. The May update was costed at $6.7 billion, and funding the plan we're releasing today will cost $10.3 billion. And you can see that in a way as a metaphor for the explosive impact of the virus. So I will run through the key elements of the plan itself, but first, and perhaps even more importantly, I want to talk a bit about our estimates of the cost of doing nothing in these poor and fragile countries, because COVID-19 and the associated global recession are about to wreak havoc in fragile and low-income countries. And my message today, especially in the run-up to the G20 finance ministers meeting, to them and to other rich nations, is that unless we act now, we should be prepared for a series of human tragedies more brutal and more destructive than any of the direct impacts of the virus itself. Inaction, as Tedros and others have been stating very clearly in recent months, will leave the virus free to circle the globe. It will undo decades of development, and it will create a generation's worth of tragic and exportable problems. But it doesn't have to be like that. This can be fixed with money and leadership from the world's wealthier nations and some fresh thinking. We estimate that the cost of protecting the poorest 10% of the global population from the worst effects of the pandemic and the global recession is about $90 billion. That's less than 1% of the stimulus package wealthy countries have put in place to protect the global economy. Today's plan is an important part of that solution. For $10.3 billion, it will help 63 vulnerable countries and cover the global transport system necessary to deliver the relief. So why should wealthier countries fund this? Well, my office, working with the University of Oxford, has produced the first comprehensive and detailed assessment of the costs of inaction. And I want to highlight three of its conclusions. First, the human and economic costs of increased poverty and hunger. The pandemic risks inducing the first rise in global poverty since 1990. At least 70 to 100 million people could be pushed back into the extreme poverty category. In addition, an extra 130 million people could be pushed to the brink of starvation by the end of this year, bringing the total to 265 million people, a doubling of people facing starvation. Secondly, there's the economic costs of protracted containment measures on education. A protracted school shutdown of 5 months could generate learning losses that have a present value of $10 trillion globally. The average student losing out on 5 months of education could face a reduction of $16,000 in lifetime earnings in present value terms. School closures threaten not only education, but also nutrition, and they make girls more vulnerable. For example, during the 2014 to 16 Ebola epidemic in West Africa, school closures led to an increase in teenage pregnancies of 11 percentage points in Sierra Leonean communities. And thirdly, there's the cost of increased global instability and conflict. An additional 13 countries are projected to experience new conflicts between 2020 and 2022 relative to pre-pandemic forecasts. If that materializes, global instability would reach a new 30-year peak. Conflict is expensive. The minimum cost incurred during an average civil war to both host and neighboring countries has been estimated at approximately $60 billion. Refugee outflows would likely increase. The World Food Programme calculates that for each percentage point increase in acute hunger, refugee outflows increase by 2 percentage points. So let me come on now to the plan we're releasing today, and let me take the opportunity to thank hundreds, probably thousands of colleagues across humanitarian agencies, across the World Health Organization, the World Food Programme, UNICEF, hundreds of NGOs who've contributed to the update of the plan for their work. The main components making up the $10.3 billion are $8.4 billion for country level responses, $1.8 billion for global requirements, including more than $1 billion for humanitarian air transport, getting aid workers in and out, getting supplies in and out, and for our medical evacuation system for medical workers and aid workers working for international organizations who get sick. There's $300 million in supplemental funding for NGOs, in addition to what we've got for NGOs in the country plans. NGOs, in fact, benefit from something like 30 to 40% of all the resources, directly and indirectly, we have in the plan. But we need an additional allocation for them to account for the fact that many of them face acute funding problems now. And we have to keep these crucial NGOs in business because they play such an important role in the frontline response. There's also $500 million for famine prevention. There's a serious risk of multiple famines later this year and early next year, and we need to invest now to prevent that. The plan obviously is only as effective as the funding it receives. So far, we've raised $1.7 billion. I appreciate every country is being hurt by this pandemic, but I do have to say that the response of wealthy nations who have rightly thrown out the fiscal and monetary rule books to protect their people and their economies, their response has been grossly inadequate when it comes to helping the poorer countries, and that is dangerously short-sighted. The massive problem the world faces can be addressed with relatively little money, with a modicum of imagination, and if we park the old rules to reflect today's unique circumstances. Thank you very much indeed.
Thank you so much, Mr. Lecoq, and thank you, Dr.
Tedros. Thank you, Mark.
Apologies, would you like to go say some more words, Dr. Tedros? No, sorry.